Again, my name is Patrick Phillips. I'm the founder and CEO of American Business Systems. I'm chairman of the board of the Medical Revenue Management Association of America. You can go check it out there if you want to sometime. You'll find out that this is an organization that actually certifies everybody who goes through our training. I'm also a member of the editorial board of BC Advantage Magazine. That stands for Billing and Coding Advantage Magazine. And I have articles in most issues of that magazine as well. I'm also a best-selling author. These are 3 of the books that you can find right now out on Amazon.com. It's also in Kindle version, so you can download those. Don't purchase those, though. If you want to see one of those books, ask the person who sent you the email to this webinar, and we'll see if we can't get you a copy of that in electronic format. Basically what we do, folks, is we teach people how to do medical billing for doctors and manage their entire revenue cycle. So we do that using cloud-based technology that is the leading technology that's out there. It can be run on any platform, including any IBM, Windows PC, Macintosh computers, Apple iPads, anything that you can connect to the internet, you can also run our software on. We also, of course, have operating offices all over the United States. Some of those you can actually call and talk to some of the people who have actually been through our training and find out more about their success and how they, what they think about us as a company and the business itself. So be sure and ask again the person who sent you the email to get you to this webinar. We call them your coaches, your business coach. Just get back with one of those people and ask them a little bit more about whether you can contact some of these people here. Folks, we do live training here in Dallas. It's a week long, and the next one coming up is in June. Now, so far, all of our workshops in 2017 have been sold out. This is a booming industry, folks, and if you want to get in on this, if you don't have your paperwork done by probably the end of this week, you probably won't get into this class. Now, we will have another one coming out. I think it's in maybe August, because we go about every 6 or 7 weeks we'll have another training class, depending on how many people are on there. But this is filling up fast, so get back with that person again. We've been doing this for 23 years, right here out of the same offices in Fort Worth, Texas. And folks, if you check with the Better Business Bureau in Fort Worth, you'll see that we have an A+ rating. Doesn't get any better than that. All right, so let's get right to the meat of today's webinar. This is on how to start a turnkey healthcare business. Now, let me define that for you by starting out with this picture of this nice car. Let's say that you were looking for this luxury automobile and you went and bought it and they didn't give you a key. That'd be kind of hard to get it started, wouldn't it? Well, here's the purpose of having a key, of course, and what we call a turnkey business. Without the key, this car is going nowhere. And without a turnkey business, it would take you much, much longer to get a business going. Here's how we know that. The definition of turnkey is that it's an adjective, and it says right here, it says of or involving the provision of a complete product or service that is ready for immediate use. So folks, it's kind of like we tell people you could reinvent the wheel like this, and you don't need to do that. With our business, we've already invented the wheel, we've perfected it, we've honed it. Over 23 years, we know exactly how to help you get a business started. And healthcare, of course, is a booming industry, as you'll find out as we go through the webinar. A turnkey also means that you have every component of that business already worked out for you. So as you can see from this illustration, we have a series of not just the medical billing and the electronic medical records, but we also have all kinds of other services that I'll be talking about on the webinar a little bit further today, meaning it's ready to go. Just get in it, turn the key, and get the thing going. One of the things a lot of people are concerned about is if the industry is big enough. When you ask the question, who can be my client, as you see here on this slide, this is just a small portion of the number of specialties that are out there that you can do medical billing for. Look, I've gone to the next slide here. This starts with gynecology, and as you can see, it's a whole bunch of other specialties. Here's another slide with chemical pathology and all sorts of other things there. Some of them I don't even know what they mean. Pharmaceutical medicine is on this slide here, and it goes through occupational medicine. You see all the different specialties? Every one of these folks, you can do billing. If they bill on what's called the 1500 form, that's a question you could ask any doctor. Do you bill on the 1500 form? They know what you're talking about because that's a standard form that the government came up with that allows you to bill the insurance companies and Medicare for those services. We also, of course, as I mentioned earlier, have a whole suite of services that I'll go into here a little bit more in detail, just so you know what each one of those things are. So turnkey means it's a complete system. This is why we call ourselves American Business Systems, because We've built a system. If you follow the system works. And now let's take a look at some of these, and I'll tell you about each one of them as we go along here. iClaim, of course, is the medical billing business itself. Hold on. Okay, sorry. iClaim is the medical billing system, folks. This is the cloud-based system that I mentioned earlier. And if you're wondering if medical billing really is a solid, steady business, let me go to this slide here. You've probably seen this magazine on the newsstands. It's called Entrepreneur Magazine. They've been around for about 30 years, and they have articles in there all the time about starting a business. One of the things that they've published is a series of books called their Startup Series. And one of them is called Start Your Own Medical Claims Billing Service. Now, the reason I'm showing you this is because, let's be honest, you could go buy this book and hopefully start your own medical billing claims service. You'll find that there's not enough information probably in the book to actually do that, but it's a good overview of the business. And look at this quote here from this. It says the market for medical claim billers is growing exponentially. Now, this is right out of this book by Entrepreneur Magazine. With legions of providers and an ever-expanding patient pool, healthcare industry spending is expected to grow by 5.8% each year through 2024. Now, folks, any business right now that's growing almost 6% each year is a booming business. Then it says by the year 2024, healthcare spending will total $5.43 trillion and account for 19.6% of the gross domestic product of the United States. Remember, almost 20% of the gross domestic product of the entire country is this industry. So it goes on to say, let there be no doubt, healthcare is big business and its growth shows no signs of slowing. This makes it the perfect time to start your own medical claims processing business. Look, here's another quote. This is from an organization called the Black Book Rankings. You'll see it there at blackbookrankings.com. And it says 42% of all physician practices with employed billing staff hope to outsource their billing in the next 12 months. Now, folks, think about it. Doctors are either doing the billing themselves with their own staff, or they've already outsourced it. The fact is that we're signing up doctors every day from our licensees from coast to coast. How's that possible? Because doctors want to get it out of the office. And even those who've already found a local billing company, they don't have what you're going to have. And we're going to show you how to capture the market and eliminate all the competition in your area. Here's another article out of PR Newswire, and it says that revenue cycle management, that's what you'll be doing, helping to manage the revenue cycle inside that doctor's office, is worth $80.56 billion by 2021. And folks, that's just a few short years from now. So again, a big piece of the pie, you need to get your slice of it. Here's one last quote. Market analysts estimate that 24 cents out of every dollar are wasted on administrative and billing expenses. So again, a real good reason why you should get involved in the business. That's the billing part, the iClaim billing part that we talked about earlier. Now let's talk about the electronic medical records. Folks, every doctor has had to decide how they're going to get all of their records electronically because the government mandates that and is moving towards that more and more every year. So we happen to have the leading edge technology that's out there. It's called EMRX, and as you can see, it runs on an iPad just beautifully. It was designed for a doctor to take this iPad into the patients, and look at the patient in the eye and just tap a few buttons as they're talking to the patient. It's a wonderful way for the doctor to engage with the patient and yet at the same time put everything into the system electronically. Remember, it's on the iPad, so it's connected, of course, through their Wi-Fi there in the doctor's office to our system. Everything the doctor's doing is being put into our system, and you'll be able to have access to that on your end when you log into our system as well. Now, I'm kind of giving a brief overview of all these things, but folks, EMRX has won all sorts of awards. You can do some research on it, ask your coach a little bit more about this, and you'll see that this is leading technology that's out there. Don't settle for software that comes on a CD, that's shipped to you on a CD, that you put in your computer and install it on your computer. That is not the future. The future is the cloud. Everybody's moved to it so far. Apple and Google and Amazon, everybody's on the cloud, and the cloud is the safe, secure way to store patient data. Yes, ours is HIPAA compliant. Those of you who know what HIPAA is, the government rules and regulations for patient privacy. This is a picture here of all of the different screenshots of the iClaim system and the EMRX system together. They work in conjunction with one another. They're all written by the same programmers, so they're perfectly integrated. They're not, kind of hooked together behind the scenes. They run again on all the iPads that are out there, all the computer systems. We're illustrating it here on Apple computers, but any computer system will run it. And one little other thing right here in the middle is our patient portal, a very important part of a system like this. Every patient can log in with their own ID, see their prescriptions, schedule their visits, ask questions to the doctor. Everything's right there included in that system as well. So this is why we call it a turnkey system, folks. It has everything that not only the doctor and you need, but what the patient needs as well. And just a few features of the electronic medical record system, folks. It's got cloud-based scheduling. Now, here's what that means. That means that the doctor on their iPhone on the golf course can see their schedule. Yeah, they can see when their next appointment is. And it's in real time, of course, at all times updated. So they'll see in real time exactly what their schedule looks like from anywhere, anytime, from any device that's connected to the internet. It's got a drawing feature. You can import photos, and the doctor can draw with their finger or a mouse right on the iPad there to illustrate things for that particular patient. It's got e-prescriptions built into it that have all the prescriptions that patient has ever placed with any drugstore that's online with e-prescriptions. That's the nationwide system of electronic prescriptions. So before the patient leaves the doctor's office, the doctor can have a prescription waiting there for them at their pharmacy. It's also got built-in dictation. On the iPad, there's a little microphone. I'm circling it right there if you can see my little arrow. And that is what you click. The doctor clicks that and can actually talk to his iPad, and it will put all of his notes in there as well. Yeah. All right. And, talk about the latest. We call it virtual office visits or e-visits, but you might think of it as telemedicine. Maybe you've heard that term. That's built into our electronic portal, patient portal, and as you can see, you can actually have a discussion with your doctor in real time with video and texting and speaking to them at the same time. It's just the latest in that technology. All right, now that is 2 of the 9 different things that I'm going to talk about today. Here's the next thing that's in your package. It's called Audit Guard. Now, folks, every doctor that sees Medicare patients are under the microscope from Medicare. That's right. They can walk in anytime they want to and do an audit of the doctor's office and look at the records. And if they've miscoded some of the things for patient visits, they can be fined $10,000 for each infraction. That gets very expensive. I know of doctors who've been fined $1 million plus in fines. So this service, you can provide an audit of the physician's current records. We have certified medical coders who do this audit from a sample of the doctor's records, and then they provide a professional report and a professional personal review with the physician so that he can know exactly where he needs to change things in his office to make sure that he doesn't get fined by Medicare. Very valuable. And folks, I like this because it's a great door opener. You can walk into any doctor's office and say, who is your compliancy guard here for Medicare? And, you would be looked at with probably like, I don't know what you're talking about. But it's a great door opener because once you get your foot in the door with one of these ancillary services, then of course you're a friend, right? You're not a stranger, so you can come back with other services and of course continue asking them about whether or not you can do the free practice analysis that we teach you to do so that you can get their billing somewhere down the line. Yeah. Okay, now the reason I was fiddling a while ago with my question box here is because I was trying to look at some of the questions. I saw some coming in here, and here's one that is from Marlon. Says, what's the difference between EMR and EHR? Well, electronic medical records, EMRX is what we call ours, but it's interchangeable. Marlon, there is technically some slight differences between electronic health records and medical records, but in the healthcare industry, they're used interchangeably. So even though we refer to it as EMRX, you can refer to it as an EHR, an electronic health record system, as well as an electronic medical record system. Okay, so I'll continue to look at this question box, folks, and if you've got questions, just type them in there. I'll try to look down there every once in a while and answer some of those as we go along through this. Okay, now let's move on here to one other quote. This says that the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. Now, this is by Mike Inger, the head of the VIA Code, which is a coding company. And folks, the great thing is our system has all the codes built in. You don't have to know anything about coding. But because some licensees don't want to mess with coding at all, we actually have another service that you can offer to the doctor called CodeWrite. Again, our certified medical coders can take a selection of the doctor's current patient insurance claims and tell the doctor whether or not they're coding, overcoding, or undercoding. If they're undercoding, of course, that's how they can increase their revenue by 30%. If they're overcoding, then they could be, of course, subject to those fines that I mentioned by Medicare. So it's a great service, again, a wonderful door opener, and so you can forget about learning all the codes. There are people, of course, who will say, oh, you got to go to college or take a course on medical coding. Folks, not if you have a system that's as modern as ours is. With all of the ICD-10 and ICD-9 codes, they're all built into our system. So you'll see that you don't have to know anything about the codes. Our system knows what the doctor needs to put in. All right, here's another service that you get along with this turnkey system. It's called Quick Collect. And folks, this is a great system because if you knew the facts, you'd know that doctors don't collect but about half of all the money that they bill to patients. That's right, only half is ever collected. We can increase that up to 98%. Why? Because we have a system that on the back end can collect that money from the patients. No, you don't ever get on the phone with a patient. No, you don't mail out any letters. This is an automated system, online system that does all that for you. There's no human interaction with those patients at all, and yet we can increase that revenue for the doctor up to 98%. Again, I know I'm going very briefly into all these. Our website contains more information, and of course, your coach can give you more information on any one of these particular products. If you go to our website, by the way, and register there, you'll get an email that gives you access to what we call our virtual brochure, which goes into all of these services in more detail than you'll see there on our regular website. All right, here's AuditGuard. Wow. AuditGuard. What can I say about AuditGuard other than this is the system, folks, that can help you market this to doctors. It's an automated follow-up system. So let's say you go to a networking group of some kind and you get a business card from somebody who knows a doctor and you put that in the system. This will automatically send them a printed physical postcard or greeting card with a message that you create on the inside of it. And it sends these out as you tell it to. Let's say you want one sent every month to this doctor's office that you got their business card and put into the system. Every month that card goes out without you even thinking about it. It's completely automated. And yes, it has done wonders to help licensees get clients. However, it's also used by licensees for the doctor, for their patients. That's right. You can put the patient data in here, and we have a whole series of cards. There's over 15,000 different cards in the system, and some of them, of course, are designed specifically to follow up for the patients, to remind them of various visits, to send them a happy birthday card. There's all kinds of ways that you can use this, and yes, you make money on every one of those cards that go out. It's a fantastic system. You've never seen anything like it from a marketing standpoint. It is the ultimate. Okay. I'm looking at the question box. Still haven't seen a whole lot coming in here, and a lot of statements and messages to me, and I appreciate those, but I'm just going to look for questions and answer those as I go through. Here's ChoicePay. Now, folks, this one is a wonderful system because this gives the patients the ability to pay their bill in a variety of ways. You make it as easy as possible nowadays for customers, and in this case, patients, to pay their bill, and you will bring in more money. So with this system, through our patient portal, the patient can go in and set up automatic payments to pay off their balances. A lot of people go to the doctor, they don't have insurance, or that insurance doesn't cover a particular procedure, so they're stuck with $300 or $400 in a bill for $300 or $400 or more, and they can't pay it all at once. But this allows them to pay that out. So it's a wonderful system. Again, it can increase the revenue for a doctor tremendously. Okay, let's talk about Audit Guard. Now, Audit Guard goes in and looks at the codes, similar to CodeWrite, except in this case, it's a thorough analysis of the codes that the doctor has used in his practice. And it will tell them, the doctor, whether or not they are overcoding or undercoding, and give them a series of reports. Wonderful way to open the door to a doctor's practice as well. All right, I'm not seeing questions, so you may not think this is live, but I'll prove it to you. Type a question in and I'll answer it. Unless you're watching this recorded, and then of course I wouldn't answer it because you wouldn't have a question box to put it in. Okay. All right, let's move on to iDocs now. Now people ask us all the time, how do I get the data from the doctor? What if they're still on a paper system mainly, and I want to get the information from them? We have a system called iDocs Now. It's an online document management system. And with a little small scanner, costs about $350 on Amazon, you can put that in the doctor's office, and they can scan in all the data that they need to get to you. Now, on your end, you simply log into the system. It's a cloud-based system, so you log in with their ID and password and so forth that you need, that you've set it up with, and boom, you get to see all of the documents that they've scanned. So that's how you can get the documents without having to use FedEx, without having to pick it up, without having a pile of faxes on your desk at the end of the day. This is all electronic, and it's the latest way to handle documents. Okay, and Jeanette, yes, you are listed as an attendee on here. You certainly are. Thank you for attending today. Okay, let's see. Bill says, I love this info. Could you tell me about the website assets? Are you providing templates and we take care of domain names, hosting, etc., or full sites? Bill, thank you. I am going to touch on websites here just shortly, and I'll show you a picture of some of those templates. So great question. Thank you. Now, finally, folks, I want to tell you about the Physicians Toolbox, because a lot of people might see this on our website and not even realize that it is kind of a catch-all. In other words, when we find other services that you could offer to a doctor and make money on, you want to be able to say to the doctor, if they come to you and say, hey, do you do transcription? You want to be able to say yes. And without you having to know a thing about transcription, we have transcriptionists who can do that work for the doctor that we have vetted already. Same way with credentialing. If credentialing is basically putting all the paperwork together for a doctor so that they get paid from the insurance companies, we have people that are certified to do that for you. You charge a fee, of course, you make money on that, but that way you can always say to the doctor, yes, we do credentialing. Same way with the patient appointment reminders, automated lab results hotline, and continuing education. We're continuing to add things to the toolbox all the time, folks, so that's just an extra feature that you won't find from any other company, because once you've paid our license fee, that's the last time you spend money with ABS. All new services are added to the toolbox at no additional cost for you. And of course, it's up to you as to whether or not you want to offer that even. Okay, what else do you get in a turnkey healthcare business? Well, you certainly expect some professional marketing materials. Now, folks, we've spent literally over $100,000 developing what I'm going to show you right here, our professional marketing materials. As you can see, they're all branded with our services, but they all look alike. And of course, there's a space on them, on every one of these, where we can print your name and contact information and logo right there on the brochure. So it brands us with your company name, but with our services. And again, you don't have to offer any of these services. You might just want to do medical billing and forget about all these. That's up to you. It's your business. You can run it the way you want to. But all of these are available to you. And again, we've spent a lot of money developing them. We also have postcards. I mentioned the auto card system earlier. Built into that are full color postcards and greeting cards with messages already pre-written for you. So we've spent a lot of money developing those as well. Here's the websites, Bill. Now this is just a poor illustration of some of the templates. We have lots more than this, combinations of colors and graphics and things like that. But the website is completely built for you. We add your name, your logo. If you have a logo design, we put that on the website for you. So it has all of the text that you need, all the graphics and text about every one of our services built into the website. However, you do have to register a domain. We'll show you how to do that. Now, for those of you who don't even know what we're talking about, Bill knows that you can go somewhere like GoDaddy.com and register a domain name. Once you have the domain name, we'll put the website there and give you a number of free email accounts so that you can get emails when people click to contact you there on the website. That's all included in your licensing fee, folks. Now, a professional website like this, Bill will probably verify this if he's in that industry or knows about it. You can spend $2,000 to $3,000 on a website designed as detailed as ours is. We already have those templates made for you. Bill, that doesn't mean that you couldn't have your own built. You could do that if you wanted to spend the money on that separately as well, too. A lot of people have done that just because they like one that's very unique and very, I don't know what you'd call it, spiffy. Okay, so let's see. Let me look here. I got a couple of other comments. Ada asks, can you offer all of these services when first starting your company? Yes, Ada, you can. We recommend that you go back and start looking for your first doctor to do their billing. You can use the services to get in the door. Remember, you don't have to know about a whole lot of them. Just offer it to them, and we on the back end will take care of those services for you. You can even make money on those services, but they're a great way for you to get your foot in the door as well. Yeah, so you can use those right out of the training class. Nixon says, how's the billing software different from other web-based vendors? I'm going to tell you a little bit more about the software here in just a second, Nixon, so I think it'll answer that question for you. It is very unique, and it does set you apart from the competition out there, believe me. And let's see. Celine says, do you charge anything for credentialing and transcription service for us? Yes. The people who do that, of course, that we source that to actually do charge a fee for that. But Celine, you will actually be able to mark that up and make money on that because they're basically doing that at a wholesale fee for you because you're one of our licensees. But you can mark it up and sell it to the doctor or just pass it on if you don't want to make anything on that. Yeah. Okay, I got a couple of other questions. I'm going to move on to the next slide here and I'll cover those. Okay, so folks, this is kind of a hodgepodge of all the different marketing materials and things that we provide for you. In the live training, we will hand these out. We go through every one of them, our specialty envelopes, our bottle of prescription pills here, and we even tell you about our display. This is it's kind of hard to tell from this picture, but this is a 10 by 10-foot display with lights on the top that you can use for trade shows. And so we've got everything. Books, we've got books, electronic books and physical books that you can actually use as marketing materials as well. Flip charts, we'll show you how to use those with your warm market and everything you need. Let me give you an example of one of those books. This is our latest book that I wrote with Dr. Vicki Rackner. Now, Dr. Rackner is a retired general surgeon, and she happens to feel for doctors that are out there right now trying to stay in private practice because they don't have enough cash flow. We're going to show you with this book how to help those doctors. You'll notice that our subtitle is How to Get Off the Hamster Wheel, Work Smarter, Not Harder, Generate More Revenue, and Enjoy Greater Career Satisfaction in the Era of the Affordable Care Act. We've actually changed that to in the post-Obamacare era because we are post-Obamacare for sure. So the nice thing about this is that if you'll notice down here at the very bottom of the book, you'll be able to put your name right there on the cover of the book with me and Dr. Rackner. Now talk about a marketing tool, folks. This tool alone we should be charging $26,000 for, because to have you a published author right out of our training class is something unique. Now it says forward by Susan Smith, CMRM. Remember, we certify you at the end of our training as a Certified Medical Revenue Manager. That's what that stands for. And in the book, you'll actually see that we've put your name inside on the title page here, and then at the end of the forward, which we've already written, it's a very generic forward, so we just add your name here and your contact information printed right inside the book. Again, folks, doesn't get any better than this, and get this. These books will only cost you $4 a piece. That's our actual printing cost. You can go out on Amazon and see this book is priced at $24.95 for doctors. Yeah, and you can give it away as a marketing. We're going to show you how to mark it up, highlight some things in it, and give it to the doctor already marked up so they don't have to read the whole thing. They just look at the different quotes that you've got highlighted. And folks, we've had licensees hand this book out and get calls back from doctors saying, you know, I think this identifies my problem. Could you come do that free practice analysis that's mentioned in the book? And then you go back to them. So it doesn't get any better than this. Okay, what else do we include in our turnkey healthcare business? Folks, all of this that I'm talking about is included in the one-time lifetime licensing fee. Now, those of you who've been on our website know that that's $26,000. Well, short of it about $10, I think, $25,990. But the point is that for that one-time fee, you're getting everything that I'm including here. Look, we do live demos for your doctors. We'll show you how to get that free practice analysis, and one of the steps in that is to allocate a little half-hour time when the doctor can get online from their own desk or computer or their iPhone, as far as that's concerned, or any phone, and watch this live demo of our system by our trained demonstrators here in our office. You don't do it, we do it. But what we're illustrating here is that the doctor might be looking at the demo on their computer screen while you're on your computer watching the demo as well. So you can sit in on it, you can listen to what we say, you can hear the questions that the doctors ask. And folks, we're closing right now almost 70% of all of these demos. That is, the doctors who attend these demos, 70% of them go on to do business with our licensees. So again, we ought to be charging $26,000 just for the live demos. There's nothing like this out there, folks, and you have it as an ABS licensee. Okay, by the way, those are set up online. We have a website here I'm going to show you in just a second that you can actually go online and just register for those demos, picking out the time that the doctor has available to see that. And boom, it's all done electronically behind the scenes. Now here's what I wanted to show you. This is our website that's called our licensee support website. Let me see if I can get to it here in real life and switch to it here. Okay, I think I switched to this. There, now you should be looking at our licensee support site. Now when I try to pick something from it here, you'll notice that it asks me to log in, so I have that actually in a little program that keeps all my logins, and I'll just click on it there, and it's logging me in. Now you're seeing this live. This is an actual website, folks, for our licensees, but I'm giving you a preview, a peek of it behind the scenes. And as you can see, we constantly put things on this website. We have a page here that has all the news, and then you can go to the page down here, previous, and see the previous posts. Every one of these takes you to a video, a website, an article, a brochure. Folks, there's just constant updates to this site, always. And you'll even see that we go back here to September of 2014. I'm guessing that there's over 100 hours of videos alone. Look here under marketing, you've got all the different marketing things that we teach in our live training workshop. All the different services that we just covered here in this webinar are here as well. We have tools that you can use, including those custom books that I mentioned earlier, resources of all kinds, and it even has a search so you can find everything you need right here on this website. Now, I switched to that just to say this, folks. This is a complete system, and this support site is available to you as an ABS licensee for life. That's right. We give lifetime support. Remember, we've been in business for 23 years. We're doing better this year and last year than we did the year before. It's a booming industry. We'll be doing this a long, long time, and you'll be able to get all the benefits of it as well. One of the things we teach you in the live training workshop, I mentioned this a couple of times, is the practice analysis questionnaire. And here I'm kind of showing you one that was actually done with a doctor. And the report that was generated for that doctor on the right. You'll notice that we're going to increase this doctor's revenue, increase it over what they're spending now using their own staff and software. We're going to increase it $321,000. Now that's because they had a rejection rate, that is the initial claims rejection of 18%. We're going to take that down to our national average of 2%, and once we do that, we're going to give them an increase of about $26,000 a month. Now, believe me, that will get a doctor's attention. So when people ask me if there's any selling, well, let me ask you this. If you were a doctor and you saw this report based on the numbers that you gave us, wouldn't you want to at least know more? Wouldn't you at least want to try to have the possibility of having another $321,000 a year? Heck, if it was half that, some doctors would just jump at the chance, right? And they do all the time. Remember, our licensees are signing up doctors on a regular basis. Last month alone, we signed up over 70 doctors. So yes, what we teach actually does work. Then we're going to show you how to take that practice analysis and create what we call our analysis report. This is what you might think of as a proposal, but it's more of a report to the doctor as to why that practice analysis that we did for his office, why we can save them the money. Not just the report you just saw, but we go into detail in this in-depth report here. It's several pages long. We put it inside of a nice folder along with some of our brochures, as you can see here. When you take that back to the doctor, boom, it's a done deal. Just have your agreement ready because they'll be ready to sign with you. Going back to the question box, here's a question from Paul. Are there limits to franchisees in a specific area? Paul, the answer to that is no. Now, let me tell you why we don't do this. It's kind of like restricting you to a territory, right? And the reason for that is because we have never had a problem in our 23 years of licensees in a particular area stumbling across one another. There are just too many medical providers in any given area. And when you realize that you don't have a territory and that a lot of your doctors will be signed up, yes, outside your city, outside your state, in other states, your territory is the United States, basically. And I interviewed a licensee a couple of weeks ago, Terrence Patterson, who said on the webinar that he has licensees, and I think he said 8 states. And that comes from referrals, folks. This is a referral business. If you do a good job for a doctor, they know other doctors, they'll refer them to you. And no, you don't have to travel to sign those doctors up. We'll show you how to do all that through the cloud. Okay. Brian's asking if this system can be used for dentists. The answer is no. Brian, you don't want to get involved in dental billing. Let me tell you why. It's a whole nother world for medical billing. They use a completely different system. They have to have a lot of attachments because of the x-rays involved and other documents. And the dentists that are in your area don't do near the business that doctors do. They don't see near as many patients, and they don't, there's not that many people out there who have dental insurance. So now, having said that, we have a way for you to do dental billing through an online system, yes. But the reason I say no is the system I showed you, I claim, is meant for doctors, medical doctors, not dental. And it's on a completely different system. But I tell people, look, let us teach you how to sign up all the doctors in your area, and once you've done that, maybe then you could think about going to the dentist. It's just a matter of which market is bigger, which one should I be focusing on. Okay, now I'm showing you here an illustration of some of the training webinars that we've done, not for folks like yourself who are looking into getting into our business, but for our licensees. We do these usually on Fridays, not on Wednesdays. And these are done on a weekly basis as well, just about every week. We'll do a different one. Here's a list of some of the topics that we covered in some of those webinars just in the last year. So if you have not joined us, you have been missing out on a lot of good information. Now, fortunately for you, all of these webinars are recorded, and they're stored out there on that licensee site that I just showed you. So you can go back and watch those. That's why I told you earlier that there's probably over 100 hours of information that you can view there. And yes, I even get involved in some of those webinars and do what we call marketing webinars, because if you haven't got a client and you're still trying different things that are not working for you, we're going to give you new ideas constantly to go out and find those clients. And once you get one client and start getting referrals, you probably won't have to do anything after that. We've had licensees tell us that we just did what you told us to do in the training, got our first doctor, did a good job for them, and asked them for referrals, and we grew our business from there and never had to do any more marketing. Ada says, can you operate in Canada or Europe? Well, you can run your business from there, Ada, but remember, they have a completely different healthcare system in Canada and Europe than we do here. So you could not bill for doctors in Canada or Europe, but you could certainly run your business from there. Okay, so let's move on here. What else do you get with this turnkey system? Well, one of the important things that you get, of course, is our live 5-day training workshop here in Dallas. Very important that you know, folks, that this training workshop is essential to your success in this business. It's not that people haven't gone through our whole system without coming to the live training workshop, but it's very rare. And here's why. You're going to find that during this class, during this workshop, you have hands-on ability to learn the system. We bring in the laptops the very first day and show you exactly how to use the system. We also do exercises. You'll learn with other students in the class things about the business that you wouldn't learn just studying on your own. Here's some folks doing one of the warm market presentations using the flip chart that I mentioned earlier. So folks, this is an interactive workshop that is just essential. It's 5 days. It's Monday through Friday, 8 to 5 to 5:30, depending on what we get covered. Every day but Friday. Friday we'll let you out early, about 1 o'clock, so you can get a flight and get home. This is just an overview of the actual live training workshop. Some of the things that we actually teach during that workshop and cover during the workshop. Folks, this handout, by the way, if I'm going too fast for you, is in the handout section. I don't know if you've noticed that or not, but go back to the control panel there, somewhere where that question box was, there is a handout section. And the handout is there. It's all these slides that we've created for you as a PDF, and you can download that right now before the webinar is over. Now, at the end of that live training workshop, of course, you're issued your certification as a Certified Medical Revenue Manager. Again, that's done by the Medical Revenue Management Association of America, and that is something that you can show doctors, you can put on your wall, you can hand it out in your literature to show that you are certified. You'll also get a series of a selection of books, The New Thriving Medical Practice. I think we give you 20 of those to start with, and then after you've gone through the training, you can get your customized versions of that as well with your name down at the bottom. And your contact information there, as I showed you earlier at the end of the forward. Now, I mentioned lifetime support earlier, folks. Let me tell you what that includes. It includes the toll-free phone number to our ABS support team. It includes email with 2 to 3 hour turnaround. We have live chat with our success team, 24/7 private licensing support website, as I showed you earlier, and of course our nationwide licensing network. Folks, just the fact that we have hundreds of licensees from coast to coast, we can put you in contact with those people. If you're struggling in some way, or you sign up a new practice that's a different kind of specialty you don't know a lot about, we'll put you in contact with one of our existing licensees that can help you with that. And of course, we have over 50 technology support staff. Here's an actual picture of one of our support rooms with our technology partner who actually supports our licensees from that support room. All right, I mentioned this printout. It's over there right now. Let me talk as I wrap up here and get to some other questions about our money-back guarantee. When you go through our training, folks, you'll find that at the end of the workshop, for any reason, you don't think this business is right for you, simply tell any staff member and they'll arrange for you to receive a full refund of your licensee fee. That's right. So the $26,000 you invest with us, come to the training workshop. If you don't like it, by the end of the workshop, just tell us. We issue you a check with all of that money back. Now, how do we do that? Well, first of all, we haven't done it but a handful of times in 23 years. But it does tell you that we believe in what we're doing, and we want you to feel comfortable that this is something you really can do. And once you've made that decision by the end of that week, you're off and running. And there's no weasel words in that, folks. People ask me how we do that. Well, again, we haven't given but a handful of those away, and so we would go out of business, right, if we were offering that to everybody, of course, who came to the training. Here's our website. If you haven't been there, it's absystems.com. Now, somehow you got on this webinar, and you may not have remembered even where this webinar website is, but there it is. Write that down, absystems.com. And if you haven't seen our virtual brochure, be sure and click on this orange button up here and register for it with us, and we'll send you a link to our virtual brochure that gives you much more. Here's a shot of that site. Much more information than our regular website has. And I want to invite you to come down and visit us anytime you want to. Just ask your ABS coach about how to do that. We'll arrange for you to come and meet our staff, answer any questions that you have, and just get to know you a little bit better eyeball to eyeball. Now, I mentioned our training workshop that's coming up in June. That's June 12th through the 16th. That's a week from this Monday. So again, you should have your paperwork done if you're going to be in that class. Now, if you're still working on that with your coach, don't worry about that. We've already reserved your seat if you put down a deposit there for that workshop. If you can't make this one, continue to attend these webinars. We do these every Wednesday at 4 p.m. Central Time, and we'll be glad to continue to answer your questions, continue to share information with you at no cost, and tell you as much as we can about the industry. The training's real simple, folks. We show you how to fly into the DFW International Airport. The hotel picks you up from the airport. They're only about 10 minutes away. I mentioned earlier the classes are Monday through Thursday at 8 to 5 and then Friday 8 to 1. And lunches are provided by ABS each day, of course. And your licensing fee, of course, does not include travel or hotel. So you're going to spend about $700 for the week for the hotel. Very nice Marriott suites, very comfortable. You'll enjoy being here, and you're right across the street from Texas's largest mall with restaurants and movie theaters and all sorts of shopping, of course, is there. So you'll enjoy your time down here. I'm going to put the screen back up here and go back to the question box here. Now, look, looking at my clock here, I've only got about, maybe 8 minutes left. I'm going to take that 8 minutes to focus on the questions that you folks are typing in. Let's see. This is from Nadine. Can this business work in Toronto, Canada? I think I mentioned earlier that you could work the business there, but they don't have the same billing system. They don't use the same forms or anything else in Canada. So you couldn't sign up the doctors there, Nadine. Rodney says, do you license in the state of North Carolina? Yes, we do. In fact, we license in all 50 states, and we do have licensees probably in most states, but that doesn't mean that they're out there marketing right now. They may have gotten in the business 5 years ago or 10 years ago and already have the clients that they want and need to make the kind of money that they want to make, and so they stop marketing. So we call them active. There's not but a handful of active licensees out there marketing at any one time after they've gone through the training and gotten their first doctor. Let's see. Okay. Oki says, do you need an office space to run this business, or could you operate out of your home? Most of our licensees operate out of their home, Oki, even if they've been in business for many, many years, because the doctors don't come to see you at your home. You're actually going to their office to get everything set up. Doesn't mean you couldn't eventually open an office. A lot of licensees have. I talked to Terrence again a couple of weeks ago, and I think he mentioned that he had an office and 4 or 5 people, working for him out of that office. That would be when you got to the point where you had so much business, you needed to hire people, and you wanted a place for those people to come and be there. That's about the only reason you'd need that office. Lipika, hope I'm saying that right, says, what are the supports that we expect to get the first client? What are the supports we expect to get the first client? If you're asking about how soon you might get your first client, that varies. It depends on whether you're doing the business full-time or part-time. A lot of licensees walk out of the class and have people lined up to go talk to before they even came to the training class, and have their first client within the first 30 to 60 days. Now, some people take longer than that, depending on what they're doing and which methods they're using, but you could expect on average probably 60 to 90 days maybe. I have licensees who've taken 9 months to get their first client because they tried things maybe that were outside of what we teach. If you follow our system, you should be able to get a client fairly quickly. That'll always be an individual thing, of course, so it's kind of hard to tell any one person how quickly they might get that first client. All you need is one doctor to make back your $26,000 licensing fee, so it's not like you have a big, huge hurdle to get over there. Marcellus says, how much is the potential revenue? Sorry. Marcellus, we have to be very careful there because as a business opportunity, the government has some rules and regulations about what we can say about income. Let me show you something here that might be of help. I'll actually go to our site here to show this. And those of you who didn't know that this was here might be interested in seeing this too. So let me go to our website here. This is our absystems.com website. Look, we have a little calculator right here under income potential. And it's called a medical billing income calculator. So if you'd like to know how much you could make, you just plug in some numbers here. This is just one doctor seeing 20 patients a day, 5 days a week, and with you charging 6% of an average bill of only $100. Now, these are very conservative numbers, folks, and as you can see, if we submit that, you'll be making $31,000 each year servicing one medical office. So you can put in your own numbers. Go there. I encourage you to go put your own numbers in there and see what you come up with there for your own projections of income. Well, thanks again, folks. I'm looking forward to meeting all of you eventually down the line, and I hope you continue to come to our webinars, learn more. Bye for now.